Today, Great.com talks with Amanda Springer, who is Director of Program Solutions at MiracleFeet. If you haven't heard of them, they are a non-profit organisation on a mission to ensure every child born with Clubfoot can access and afford the correct treatment. If you are new here, please press subscribe on YouTube or on your podcast app, because today we learn the effects of Clubfoot has on children around the world. Hello, Amanda, and welcome to our podcast.
Hi, Ryan. Thank you for having me, and a very, very happy birthday to you.
Thank you so much. So, Amanda, for me and anybody new here, what is MiracleFeet and what do you do?
So MiracleFeet exists in order to eliminate disability caused by a very common birth defect called Clubfoot. So Clubfoot affects about 1 in every 800 children that's born worldwide. That instance is the same no matter where you live, but how that affects you is very different based on where you live. So I don't know if you've ever heard of Clubfoot or if you know anyone who was born with Clubfoot, but essentially when the baby's born, their feet, either one or both feet, are turned inward and upward, and they need to be corrected in order for that child to be able to walk properly. So if Clubfoot is left untreated, it will be very difficult for that child to walk. It will be very painful. Sometimes they would not even be able to walk at all. And so in a lot of higher resource settings, and I was born with Clubfoot, 43 years ago, and I was lucky enough that where I was born, I had access to proper healthcare and treatment and the ability to travel, to go see the best doctors to treat that Clubfoot. But so it's routinely treated at birth in wealthier countries. But in a lot of low resource settings and low income countries where MiracleFeet works, children who are born with Clubfoot often don't end up having the ability to go to school. So not only is mobility an issue, they're often hidden away. They're exposed to greater instances of abuse and neglect. And a lot of these countries where we work, the environment isn't set up to allow a child with a disability to thrive. So MiracleFeet is on a mission to change that. We estimate only 1 in 5 children that's born with Clubfoot actually does have access to proper treatment. So we're on a mission to change that with a lot of other folks and organizations working in Clubfoot. So what we do is we partner with local organizations. So having that local presence and someone buying into the importance of treating Clubfoot is how we work. So we don't send doctors in to do treatment and then leave. We invest in local organizations. Most of the clinics where children are treated in the countries where we work are in public hospitals, and that treatment is free to the families that get it. So we treat the children. We also provide training in the method used for treating children to doctors and healthcare workers, physiotherapists, physical therapists. There's a lot of folks who have a part in and can do Clubfoot treatment. So we invest in the treatment, we invest in the training, we work on advocacy. Eventually, we want the local government to think this is important enough to take on and pay for. So we focus on where is political will in that country to take this on as a cause, and we work to integrate that Clubfoot care into the national health system. So MiracleFeet's been in existence for, I think we're in our 11th year. We've treated over 65,000 children by way of our local partners, and we're in 30 countries today, all over the world. So Latin America, Asia, and Africa.
Wow, thank you so much, Amanda, for sharing that with us. One thing that really stood out for me there was you said sort of left untreated, obviously things can get worse. How long would it need to be treated, like Clubfoot? What is the procedure, or is there a cut-off time where it is untreatable?
That is a great question. So we prefer the earlier a child gets into treatment, and that's where some of our early detection and referral practices and awareness raising activities really come into play. We want the Clubfoot to be diagnosed as soon after that child is born as possible, and we want to get them into treatment as soon as possible. Ideally, a child would be treated before they would attempt to take their first step. So we treat Clubfoot, our healthcare workers treat Clubfoot with the Ponseti Ponseti method. And the Ponseti method has become the gold standard of treatment for clubfoot, but only over the past, not only probably 30 to 40 years, it's really taken for it to be widely accepted. For instance, 40 years ago, I was treated with surgery. And the Ponseti method was groundbreaking. And it's incredible to see how simply, right? And I use simple as, it's a straightforward procedure. It's non-surgical, it's non-invasive. And essentially it starts with a series of casts. So plaster casts, just like you'd wear if you broke your arm. The child will come into an appointment. And part of the Ponseti method is maneuvering the foot. So they'll take the foot in its twisted position and do a maneuver that starts to bring the foot back to the position we want it to be in. And that manipulation happens little by little. So they'll manipulate the foot. They'll put a first cast on, and that cast will stay on the child for a week. And then they'll come back to the clinic the following week. The cast will be taken off. The foot will be manipulated a bit further. There'll be another cast put on, and so on. So that serial casting phase lasts usually between only 4 and 6 casts. So usually by the time a child has had their 6th cast, that foot is in a great position. And then they will have a simple outpatient procedure called a tenotomy. And a tenotomy is local anesthetic, and the doctor will cut the Achilles tendon, which allows for the foot to have a greater range of motion. So it grows back together. And I'm not a doctor, right? So don't ask me any questions about a tenotomy procedure. But once that tenotomy is done, the child will have a final cast. And then after that final cast, the child moves into the bracing phase. So you can see the MiracleFeet brace behind me. It's a foot abduction brace, and it consists of a bar and a pair of shoes. And the shoes are meant to keep the foot in the corrected position. So just think about it if you had braces put on your teeth. So your teeth get straightened out, and then that orthodontist is going to require you to wear a retainer for a certain amount of time to keep your teeth in that corrected position. So bracing is very key. And a lot of times a parent will look at the foot and it will look corrected, and they'll be like, whoa, why is this brace important? But it is so, so, so important. So proper Ponseti, the child should be in the brace 23 hours a day, except for bathing, for the first year following the casting phase. And then after that first year, the child will wear the brace at night and during naps. And usually that continues for about 4 to 5 years. And then after that, most of these children, in 95% of cases for children treated with the Ponseti method, you would never know that they had clubfoot. And they go on to live very healthy and productive lives. And it's just amazing. They're running around. They look like any other kid in terms of their mobility and being able to participate fully in life and get a job. And it's incredible. So we do, follow-up studies with the parents and patients who have been treated. And in 95% of cases, parents report that their child can walk with no difficulty at all. And they have really great outcomes. So the Ponseti method is unbelievable. That's what we train all providers in for treatment. And it's incredibly groundbreaking. And it only costs about $500 a child to treat. So it's just an incredible return on investment, an incredible result, a great story. Very proud to be a part of this organization.
Wow, that's absolutely amazing. And the cost of that, what that could do for that, say, individual, for not only their life, but also their, say, loved ones or their carers' lives.
Yes.
For that little cost. Have you guys, say, worked out the ongoing costs it would have on say the country or whatever, if that child was left untreated, like the ongoing effects later on in their life, for, say, if they needed support going on, not having that, say, £500 treatment?
So what we have worked out is the return on investment for what that will do for the child and their community. So a $500 investment, right, when a child is born, we estimate would lead to $120,000 US dollars of increased lifetime earnings over the lifetime of that child. So that's an ROI of 240 times, right? So it's pretty incredible. And so when you think about a return on a philanthropic investment, right, if you want to just talk funding and what that can do. So that's a child, like you said, it's the child, it's their whole ecosystem, it's their family, their ability to contribute, to get a job that affects a community, and that can affect that it branches out. So it's not just the child that benefits from that. So yeah, 240 times investment is a pretty incredible case to make. But of course, the mobility you can't put a price on.
No, wow, that's just amazing for both, say, like for the individual and just wow, for the community as well. So
I know, I said wow too when I found out about MiracleFeet. I said wow, wow, who knew?
It just amazes me, like for that little amount of money to improve someone's life, not just maybe like a section, like that's their whole life. It's mind-blowing. But
yeah, to sit with parents who are watching their child run around and kick a soccer ball and to play with their friends, and there's absolutely nothing like it.
I'm sure. So why would you say then what you do, why would you say it is so important?
So I think the bottom line of why this is important, it's not really about Clubfoot. So we fill this niche in the world, which is we don't want a child to grow up with a disability caused by Clubfoot. But what it really is, Ryan, it's an equity issue. So to me, this is about what every child deserves. So every child deserves to have a chance at this. It's not fair. We don't live in an equal society where you happen to be born dictates your opportunity and access to something that every child has the right to have. So we truly believe every child has the right to access treatment. Every child should be able to get the care they need. It's a fundamental right. And I think that's what really drives us. And when you think about, the low cost of treatment, that we're talking about 180 to 200,000 children a year. Now there's probably under the age of 10, probably more like 5 million children living with untreated clubfoot. But in the scheme of global health, I think this is the best kept secret out there. Like this is an investor's dream come true, if you want to talk like that, right? How little it would cost, and we estimate between $15 and $16 million a year on an ongoing basis, like at full capacity, treating 70% of the children born with clubfoot. That is nothing. That's nothing. It's a drop in the bucket. So we think treating clubfoot is the best kept secret, and really we've been so encouraged over the last year. Clubfoot is starting to get a platform. The Clinton Health Access Initiative, CHI, published a paper on clubfoot, which was huge, that came out last July, and people can go to our website and check that out. But people are starting to learn and see the impact that this treatment can have and the solvability of this problem. How often do you look at a public health problem like this and say, oh, we actually see a way to solve this? So again, it's about equity. It's about what children deserve, and we think we're sitting on something pretty darn incredible.
Yeah. Oh, thank you again just for sharing that with us. So I'd like to ask, say, since what I believe its founding was in 2010, what have been, say, some of your greatest challenges, and how have you overcome them?
Yeah, that's a great question. So 2010. Our co-founder and now our CEO, Cheska Colorado Mansfeld, really just had a dream and said, I think that we can do this. And the first clinic that we worked with was located in Brazil. Cheska knew a doctor in Brazil and hopped on a plane and said, I'm going to go talk to her about what a clubfoot program may look like in her hospital. And that's how it started. So we have a legacy of kind of being very scrappy. And who's going to listen to us? Who cares about this? And we will talk to anyone who listens. I would say some of the challenges I'll start with what's near and dear to my heart. I am actually MiracleFeet's Director of Program Solutions. And what my department does, my piece of the organization does, is provide technology, services, and products to our partners and to our clinicians to help make their job easier. So I would say MiracleFeet is very innovative, constantly looking for ways to do things better. And so, for instance, in 2014, we noticed, and this was before I joined. So I joined in 2015. So I say we, but I sometimes talk like I've been here for 10 years. So we noticed that children did not have access to a good foot abduction brace. So there were some locally made braces, and they sometimes did not have the right type of quality that we would want to see in a brace, or there were imported braces that were incredibly expensive and unaffordable for the families and the health system. So we decided we wanted to make a low-cost, high-quality foot abduction brace that could be used in the clinics where we work. So in 2015, we partnered with Stanford's design school, a project called Design for Extreme Affordability, and they designed that brace. And we partnered with some manufacturing organizations who Suncast makes the bar, and then Clark Shoes designed the shoes and started manufacturing the shoes. And now we have another great partner with that called Fortune Footwear. And so we found ways and people passionate about making an affordable clubfoot brace, and we're able to roll that out. And now we've sent out 35,000 braces into 39 countries around the world. And we see that even growing more. So that was something that was a challenge that we addressed with technology, assistive technology in this case. And then we also wanted to get good data. So we were collecting data. It was going into a database. The database wasn't necessarily the easiest place to be able to get information about what was happening in clubfoot treatment. So thanks to a grant we got in 2016 from google.org, we built a mobile application. So it's called CAST, and it is used all over the world now. So in our clinics, we have an application on a mobile device. And at the point of treatment, it's an electronic medical record. So a provider that's giving treatment to a child will record that treatment in the mobile application. And then we've built data analysis platforms around that so we can track the quality of treatment. So there's 5 globally accepted measures of clubfoot treatment quality that we now are able to look at on a dashboard. I can look at it right now and see what's going on around the world and the quality of treatment that children are receiving. So we've addressed those challenges with technology. I think probably one of the biggest challenges that we have is how we and why we have such an approach now on advocacy and political will is it's so often overlooked. So because clubfoot is overlooked, not a lot of people care about it. It's not necessarily the first area where a Ministry of Health, for instance, is going to put resources. And so a lot of what we do in the countries where we work is our partners are trying to advocate with the local governments to say, you should care about this. Clubfoot treatment should be a part of a standard curriculum that medical professionals are getting when they're in college. We should be able to access braces and plaster of Paris for our casts and through the local health system. So we have partners and countries in various levels of maturity there. But I would say that's one of the challenges that we're strategically need to address, because you don't want, if MiracleFeet were to go away, we wouldn't want any program to collapse. So it's really from the ground up, we're treating children and trying to increase the coverage and the amount of children we treat, but we also need that top-down approach to build political will to make this, something that's adopted and mainstreamed into the local healthcare systems. So, I mean, we face challenges every day, but like I said, scrappy organization, a lot of will, a lot of drive, and a lot of really passionate people trying to make this work.
Yeah, I feel like that question there about some of your challenges, also what you mentioned about, say, the app, etc. That's also, I think, answered one of my questions, which would have been, what are some of your success stories? Because I feel like the app there is absolutely brilliant. Like, you've kept up to date with the technology, So yeah, you're all up to date, and you can have it all there in your pocket if you need. So yeah, that's a brilliant answer there. Thank you so much. So I want to ask you, what would you say are some of the biggest needs of the individuals that you support, and how are you part of the solution?
So when I think about the needs of families and children, there's a lot of times, since our clinics are located in public hospitals, where it is difficult, depending on where a family lives, to be able to get to treatment. So, we have some families, and there's some really, really heartwarming videos on our website about, a father in Tanzania who will put his wife and his son born with clubfoot on the back of a bicycle and ride his bike for 5 hours to get to the clinic to be able to have his child get treatment, right? So there's things like access, there's things like transportation. It often will take a lot out of a family to someone's not working for a day to be able to get to the clinic. So we think about, how we may be able to enable easier access to clinics and spread out and strategically open clinics in areas that will make it easier for the people that don't live in the urban areas to access treatment. So that's a challenge that we're trying to address. Things like we're rolling out an SMS texting solution right now that will send encouraging messages to parents during treatment. It can be hard, right? I remember I never wanted to wear my brace. Like, I don't have a lot of memories of Clubfoot, but I never wanted to put that thing on. And you got a parent who's trying to put a brace on a crying child, or they're wiggling around, or this is uncomfortable. And we're going to be sending, and we are doing this now in a couple of countries as we roll it out, but encouraging messages, you can do this. Bracing is really important. Appointment reminders and things like that, so they can stay in follow-up. So we don't want to see children drop out of treatment, and so we're constantly looking for what are the barriers to children's treatment. We want providers to feel like they have enough education and they know how to do the procedure, the Ponseti method, effectively. So just making sure we've got the right training happening. We've got trainers in every geographical region who can provide that training. Those are some of the different challenges that we try to address. I hope that answered your question.
Yeah, no, that's a great answer again. And yeah, like you did say a lot there. It was very descriptive. So it's nice as well, like, to say you can support those individuals, especially the parents, because I'm just trying to think of the right words here. Like, it must be so draining for the parents sometimes. Like, not to sound like they wouldn't do it, but it must be so draining for them. And like you say, like, I remember, say, for instance, even just me as a child, just putting shoes on, but I probably didn't want to put them on. And say my mum used to have to try and get them on me. And if you've got brothers and sisters as well, and that one parent on their own, maybe the other parents at work or not there, it must be so hard for them sometimes. So yeah, those words of encouragement, like just a small text, like it's amazing, like how something so small and simple could have such an impact on somebody's day.
Yes, and when you're talking about that, I'm also reminded that in a lot of the countries where we work, there is tremendous stigma attached with clubfoot. So a mother that has a baby born with clubfoot, there are, unfortunately, we still live in a world where people will look at that and they'll blame the mother. They'll say, this is your fault. I don't know what you did, but there's a curse on your family. The child is cursed. We don't want anything to do with this child. Families, we've had stories of families breaking up over this. So this is very real. The society pressure, the amount of shame that is often put on mothers in many of the countries where we work about this. And so when I talked about the ecosystem of support that we're trying to provide, awareness raising is a huge part of that. So we have some countries where, like in Liberia, we have this group of people, and they're called foot soldiers. And they walk around and they go to to every village, and they put up posters that says, this is clubfoot. it's very common and it can be treated. And it's so simple, but that is so important that people understand. And if you look at our, our parent materials that we distribute, one of the first things is this is not your fault. Your baby is perfect. Your baby is beautiful. You couldn't have done anything different, right? This is a common birth defect. It is one of the most common birth defects in the world. And oh, by the way, there's treatment that you can access that's right down the road from your home. Hopefully, we hope we'll always be able to, we'll be able to say that for everyone. So awareness building is so important. And the more that we can get others and influential organizations in the healthcare sector like CHAI, our brace is on the WHO assistive products technology list, specifications for the brace. So all of those things, more people talking about Clubfoot, more organizations interested in Clubfoot being a part of the programs that they have, all those things work together to just make this, I hope it's as common as anything to hear, oh, that person's it's Clubfoot, it's just Clubfoot, right? And so we do deal with very real challenges that these parents are facing, and it can absolutely be a drain, 100%. So that parent support, we have clinics. In the clinics we employ, or the hospitals employ parent educators. And these are people, and often, sometimes they're volunteers. So a grandmother who had a grandchild born with Clubfoot will go and talk to parents. In Uganda, we have what's called Ponseti guides, and they sit with parents and they just tell them, this is what to expect. And it's all okay. And I've witnessed an amazing physiotherapist in Tanzania sit with a very scared family, and you can see it. And I didn't speak their language, but I could see it in their face. The baby was so tiny, 2 days old, I found out, and they were terrified, and you could just see it in their faces. And this physiotherapist in the clinic just sat down and spent, and there are children running around, there's babies crying, there's 24 people in the waiting room in the room, and this physiotherapist sat down and put her hand on the mother's arm and spoke to her in Swahili. And I knew, I couldn't understand a word, but I knew she was saying, like, your baby's going to be okay. So to watch the expression on that mother and father's face as they came to the realization through this conversation that there's actually hope here and we're in good hands, and this is what the process is going to look like, and we will be successful, and our child will have every opportunity, is, it gives me chills as I talk about it, because there is hope. And yeah, again, like, just so amazing what our providers and partners are doing around the world. It's incredibly inspirational.
Yeah, that certainly is. And yeah, hope, you said hope, like we all need hope to cope. So I know it's pretty obvious, but what is your vision for the future, Amanda?
Our vision is a world free from clubfoot disability. No child will ever see clubfoot as something that's holding them back. And we do believe that we will see that in our lifetime. It is very, very possible, and we're going to work until it becomes a reality.
Brilliant. And if anyone's listening, what can somebody do to help, and say what action steps can they take to be a part of the solution?
Yeah. Thank you for asking that. I mean, of course, we rely on donations to keep this organization going. Please visit our website. And before just clicking in or making a donation, again, like $500 can treat a child fully, which is incredible. But look around at the stories, get to know the parents who are receiving this treatment, who have gone from feeling hopeless to having hope. Read that, see if any of that resonates with you. Talk to others about this and spread the word, right? Anything you can do to support, share, donate, whatever it is, but raise awareness for this condition and the fact that it can be treated. We take any help we can get. Just unbelievable people, children who have done school projects to help raise awareness about clubfoot. adults born with clubfoot who are running races or doing triathlons and wearing a MiracleFeet shirt to bring awareness, and anything like that helps. And we love our donors, our supporters, and our advocates and cheerleaders. They're everywhere. So I would just encourage everyone to go take a look and learn a little bit more about this treatable condition.
Oh, Amanda, thank you so much. And for you listening, if you've enjoyed this episode, please press subscribe on YouTube or in your podcast app. That will show the algorithms that this is an important conversation, so more people can learn about the importance of supporting children with clubfoot.